Emergency Medicine Collaborative was initiated out of a request for some leaders in Ghana. Back in 2008, there was a delegation from Ghana that came to visit Professor Tim Johnson. There had been several incidents that brought about the need for emergency care in the country, and so during their visit to Michigan, they spoke with Professor Johnson about their wanting to address that need, and he directed them to our department here.
Because our overall goal is collaboration, and as healthcare providers, our first goal is improving the health of populations. So really it's to improve emergency healthcare for people in Ghana, but it's also to advance the healthcare system in Ghana by providing advanced education, not just for nurses, but also for physicians, medical students, and then to advance the delivery of healthcare through a collaborative teamwork model.
The physical structure doesn't really mean anything to the patient. It's the human infrastructure. What's really there to make sure that their care is the best it can be is the people that we have in place, the training that goes on, and how well prepared they are to receive that patient when they arrive to the hospital. So every year, our government, because we're a democratic society, spends money to help people that can't help themselves. If you could help that society build up their own infrastructure and their own support system, would we have to go to Haiti if they had emergency physicians trained in Haiti? Would we have to send $60 million to Haiti if their architects there knew how to build structures for their setting? Would we have to spend that money? If we create structure in some of these developing countries, then the huge amounts of money that we need to send when a disaster happens will be averted because they'll have their own disaster management teams. They'll have their own sort of infrastructure in country such that they can manage these things better. But in the realm of developing a country and taking a country from a developing country to a developed country, what needs to happen is that large percentage of population from 18 to 40 needs to be working. They need to be available to work. And if they're dying at 20 from a simple asthma attack or a hypoglycemic episode at home, then they never get to the working age. They never get to produce GDP for the country.